Back pain takes various forms, from a persistent dull ache to sudden sharp pain, and has many causes. Sometimes it results from exerting too much force on your back, such as by lifting or moving heavy objects or by repeating certain movements, especially those that involve twisting or rotating your spine. It can also result from an inactive job, especially if you have poor posture or sit all day in a chair with inadequate back support. It can also stem from a disease or medical condition, such as arthritis. Many people develop back pain in part because they're overweight or sedentary. Consider these simple tips to prevent back pain. Pay attention to your posture. Your posture contributes greatly to your back pain. If you practice good posture, you will maintain the natural curves of your back and help keep it strong. To promote good posture. When standing, balance your weight evenly on your feet. Don't slouch over the computers and telephones when texting. Don't sit straight for 7 or 8 hours a day. Choose a chair that supports your lower back and should be set at an angle of about 110 degrees. Adjust the height of your chair so that your feet rest flat on the floor and your thighs are parallel to the floor. If necessary, use a wedge-shaped cushion or lumbar pad. If possible, rest one foot on a stool or box about 6 inches high and switch feet every 5 to 15 minutes. Remove your wallet or cell phone from your back pocket when sitting to prevent putting extra pressure on your lower back. Break up long periods in front of the computer with stretching exercises. Modify repetitive tasks. Even small amounts of stressing on the structures in your lower back can add up and lead to degeneration and pain over time. Modify repetitive tasks by use lifting devices when available, to help you lift loads. If you work at a computer, make sure that your monitor, keyboard, mouse and chair are positioned properly. If you frequently talk on the phone and type or write at the same time, place your phone on speaker or use a headset. While opening a door, stand straight in front of the door's handle and pull it perpendicular to your body. Avoid standing on the side of the handle and twisting your trunk while opening the door. While vacuuming, hold the vacuum cleaner in front of your body with both hands and use small arm movements while cleaning. This helps reduce twisting forces on your lower spine. While shoveling, rest one arm on your thigh while slightly bending the knees. This helps prevent large arm movements and prolonged stooping. Using techniques such as these on a daily basis helps prevent chronic injury to the back. Get more exercise. Regular physical activity can help ease inflammation and muscle tension. One of the most important things you can do for back pain prevention is to get up and get moving. This is because muscles are meant to move, and if you are not in good shape, you're more likely to hurt your back and feel pain when you do even simple movements. Also, exercise helps keep your joints fluid and helps you keep your weight down. Core muscles can be strengthened through any of the following exercises, which include low-impact cardiovascular exercise, such as jogging, which helps increase blood flow to the spine and stretch your muscles. An adequate flow of blood supplies nutrients and hydration to the structures in your lower back. Water therapy, which provides a greater range of motion. Water also provides resistance by means of gentle friction, allowing the strengthening and conditioning of an injured muscle. This exercise is optimal for people who have chronic back pain and find it too painful to exercise without the supportive effect of water. Exercise ball workouts, such as sitting on the ball intermittently for about 20 to 30 minutes or using the ball for stretches and exercises that engage your core muscles. Watch your weight. Extra pounds, especially in your abdomen, can make back pain worse by shifting your center of gravity and putting strain on your lower back. Staying within 10 pounds of your ideal weight may help control back pain. Maintaining a good eating habit in addition to proper exercise will not only maintain a healthy weight, but you also will not put unnecessary stress on your body. A steady diet of excessively spicy or fast food can strain your nervous system, which is going to create back problems. Conversely, a healthy diet of fresh fruits and vegetables, lean meats, dairy products, and whole grains will keep your digestive tract on track. If your intestines are working and functioning properly, that will maintain your spine because your inside and your outside relate to one another. Sleep well. The best position for sleeping is on your side with your knees pulled up slightly toward your chest. Having a supportive mattress and pillow for your head are vital as well. Getting enough, restful sleep is always an important part of maintaining good health. Many experts recommend a medium-firm mattress for those with chronic backache. It may take some trial and error to find what works for you. If you prefer to sleep on your back, put one pillow under your knees and another under your lower back. If you prefer to sleep on your stomach, place a pillow under your hips. Protect your discs immediately after waking by maintaining a straight back for an hour or two after waking. This allows your discs to regain their normal pressure and withstand loads more effectively. Check your desk. To avoid straining your neck and back, center your computer monitor in front of you, about an arm's length away. The top of the monitor should be about 2 to 3 inches above your eye level. If you wear bifocals, it may be more comfortable to lower your monitor slightly. If you can, use a keyboard tray that's beneath your desktop. Your keyboard should be slightly below your elbows. Lighten up on laptop and phone use. Your laptop may be easy to carry around, but if you use it a lot, put it on a desk and type on a separate keyboard and use a mouse. Using a laptop on your lap for long periods causes you to bend your head forward. That puts pressure on the bones called vertebrae at the top of your neck, which can trigger headaches and pain in your back and neck. If you need to use a laptop on your lap, make sure the screen is about 6 inches below eye level. That position helps lessen how much you have to bend your neck to see. You can drop the laptop on a book or something if your lap is too low. Also, limit your laptop use to half an hour at a time. Try not to type on your phone for more than a few minutes, as it will put stress on the delicate vertebrae in your neck. Save longer messages for when you can sit down at a computer with a straight spine. Take a lot of breaks. Every 10 minutes, take at least 20 seconds to stop typing to stand and stretch. And every 20 minutes, even if you took a break in between, stand and spend at least 2 minutes away from your computer. This gets your blood pumping and loosens up tight muscles and stiff joints. Safeguard your back while lifting. Lifting is a common cause of lower back pain. Common everyday activities, such as unloading bags from the car, can lead to lower back problems. Lifting with your back bent, or lifting while twisting, may cause a sudden injury to your lower back or repetitive injury over a period of time, leading to chronic tissue damage. Follow these lifting guidelines to prevent lower back injury. Bend at your knees and squat, not at your lower back, and tighten your stomach muscles. Use your leg muscles to support your body as you stand up. Pivot your feet and hips, rather than twisting your lower back. Hold the object close to your body. While lifting is a part of everyday activities, having a job that includes heavy lifting may increase your risk of developing lower back problems. Lighten up what you carry. Sitting on an overstuffed wallet may cause discomfort and back pain. If you're going to be sitting for a prolonged period, take your wallet out of your back pocket. Also, pick the right handbag or briefcase. Get a bag or briefcase with a wide and adjustable strap that's long enough to reach over your head, like a messenger bag, which is made to wear this way. When carrying a heavy bag or case without straps, switch hands frequently to avoid putting all the stress on one side of the body. To lighten the load, quit smoking. It's well known that smoking raises your risk for heart disease and cancer, including lung and colon cancers. But most people don't realize that smoking also can be a cause of persistent back pain. Research also shows smoking can make existing back pain worse. It's not entirely clear how smoking affects back health, but one possibility is that it narrows blood vessels. Narrowed blood vessels result in less oxygen and nutrients reaching the spine, and in turn, it becomes more susceptible to injury and slower to heal. Rest your back after prolonged bending. When you bend forward for a long time, such as while weeding your garden, certain changes take place in your discs and ligaments. These changes last for a few minutes, during which time, the stability of your spine is reduced. The joints also become temporarily stiff during this period. Your lower back is at risk for sustaining a sudden injury after these tissue changes if you exert stress on your back immediately afterward, such as lifting a bag of soil right after you've been bending and weeding for a long time. It is advisable to stand upright for a few minutes and allow the spinal tissues to recover and reshape after prolonged stooping or bending before attempting strenuous exertions.